Hi, it's me again, but today I'm going to talk about the vitamin D supplements and prevention of cancer and cardiovascular disease. First of all, as ever, we're gonna start with the definition. Vitamin D helps regulate the amount of calcium and phosphate in the body. These nutrients are needed to keep bones, teeth, and muscle healthy. A lack of vitamin D can lead to bone deformities, such as rickets in children and bone pain caused by a condition called osteomalacia in adults. Government of the United States advice is that everyone should consider taking a daily vitamin D supplement during the autumn and winter. People at high risk of not getting enough vitamin D, all children aged 1 to 4 and all babies unless they're having more than 500 milliliters of infant formula a day, should take a daily supplement throughout the year. The body produces vitamin D when the skin is exposed to the sunlight. The vitamin is also found naturally in some foods such as fatty fish and mushrooms and is often added to others such as milk and some cereals. Then we're gonna continue with the application in medicine. It is essential for the health of bones, teeth, and the absorption of calcium and in the intestinal level. In addition, it plays an essential role in the nervous, muscular, and immune system. It also contributes to the prevention of childhood rickets and disease that cause weakening and the formation of the bones. Winnow is a nationwide randomized placebo-controlled trial with a 2 by 2 factorial design of vitamin D3 or named cholecalciferol at a dose of 2000 IU per day and marine entry, also called omega-3 fatty acid, at a dose of 1 gram per day for the prevention of cancer and cardiovascular disease among men 50 years of age or older and women 55 years of uh, or older. Primary endpoints were invasive cancer of any type and major cardiovascular events, a composite of myocardial infarction, stroke, or death from cardiovascular causes. Secondary studies include site-specific cancers, death from cancer, and additional cardiovascular events. This research gives us the result of the comparison of vitamin D with placebo. So then we're gonna continue with the pros and cons. The main consequence of vitamin D toxicity is the accumulation of calcium in the blood that is called hypercalcemia, which can cause nausea and vomiting, weakness, and frequent urination. Vitamin D toxicity may progress to bone pain and kidney problems, such as calcium stone formation. Then, the biggest advantage we can get from this research is the knowledge that these supplements don't have much influence on the prevention cancer or heart disease, in addition to understanding the proper use of it. Then we have the issue applied in Ecuador. So in that study that we talked before, so we have a total of 25,871 participants, including 5,106 black participants underwent randomization. Supplementation with vitamin D wasn't associated with a lower risk of either of the primary endpoints. Cancer was diagnosed in 1,617 participants, 793 in the vitamin D group, and 8,400 in the placebo group. In the analysis of secondary endpoints, the hazard ratios were as follows for death from cancer: 34100 deaths. Conclusions. In the conclusions, we conclude that the supplementation with vitamin D didn't result in a lower incidence of invasive cancer or cardiovascular events than placebo. So, thank you so much.